you. All right. Good morning, everybody. My microphone is on. We are here for the Marion County Board of Commissioners weekly board session. It's Wednesday, January 22nd, 2025 still. It's like it should be 2026 with the weekend I had. Board session, that's the Senator Hearing Room, 555 Court Street Northeast in Salem. If you would, please stand and join me for the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Oh boy.
Is that as inspiring as standing in front of the Lincoln Memorial?
No.
Yeah.
Although I enjoy doing it every week. I tell you what, this weekend I was back in DC with 300,000 of my closest friends, or whatever the number was, and it was very patriotic. A Pledge of Allegiance was said quite a bit, actually.
Sure.
All right, so we don't have any public comment today, so Commissioner Cameron, would you move the consent agenda, please?
Okay, be happy to. First item under Board of Commissioners OLCC application recommended approval. JD Pho Inc. DBA is Wok and Pho Chinese and Vietnamese Cuisine, Salem, Oregon. Board Committee appointment, Ambulance Service Area Advisory Committee, approve orders reappointing Daniel Mullen, Rebecca Shivers, Jim Walker, and Stephanie McClug to the Marion County Ambulance Service Area Advisory Committee with terms ending January 31st, 2028. Board Committee appointment, Planning Commission, approve orders appointing Daisy Goebel, Nick Harville, and reappointing Stanley Birch, Mike Long, Gary Monders to the Marion County Planning Commission with terms ending February 1st, 2025, February 1st, 2025, and ending February 1st, 2029. Under Public Works, approve amendment number 1 to the standard professional services contract with Don Cushing Associates, Inc., DBA Cushing Civil Engineers, Inc., to add $227,800 for a new contract total of $996,475 for updates to the consultant entity name, scope, and services and contingency tasks for Marion County Public Safety Radio System Project through December 31st, 2027. Receive the hearings officer's decision approving zone change comprehensive plan amendment ZCCP case number 24-003, Johnny C. Davidson, and schedule a public hearing for February 19th, 2025.
I second the motion. Is there any discussion? Hearing none, all those in favor, please say aye.
Aye.
Aye, the motion passes. And we'll move on to Public Works under action to consider approval of an order to amend the fee schedule for Marion County Parks. Kevin Thompson.
Good morning.
Good morning.
I am here to present to the board's consideration.
We need you to introduce yourself.
You're absolutely right. I apologize.
No worries. Thank you. Good morning.
Good morning. Kevin Thompson, Public Works, Parks Supervisor.
Thank you.
I'm here to present for the board's consideration the approval of the recommended changes to the Parks program fee schedule. The current fee schedule has not been updated in many years. As the program's services and amenities have expanded, it is necessary to ensure that the fee schedule accurately reflects our current resources. For instance, we now offer online reservation capabilities. This week we launched online campground reservation system, and in the upcoming weeks we'll be introducing the ability for visitors to reserve picnic shelters for events and fun things like that. Means that visitors no longer have to get there at the break of dawn and wait and huddle in the cold to secure their best location. They can go online and make reservations. Good improvement for the amenities that we have in our parks. The updated fee schedule includes modest increases for certain services, such as tent camping, which will raise the fee from $20 to $25 per night. Other fees will remain the same, such as the parking fees for day use of $5 and $30 for an annual pass at parks which require park fees. Additionally, it provides clear details regarding timeframes and locations for various fees across our parks. Well, no one takes pleasure in raising fees or expanding areas where fees are charged. The reality is that industry-wide, there have been significant increases in operational and maintenance costs over the past 5 to 8 years. These increased costs necessitate an adjustment in revenue in order to provide the level of service within our parks that the public deserves. This is especially important for a program like ours, which, although currently is supplemented with general fund tax dollars, it is not intended to be funded solely through tax dollars themselves. So with that, I will open for questions.
Thank you. Commissioner, do you have any questions?
Well, just to point out the fact that we're not raising the $5 parking fee, correct?
Correct.
So that, which is the majority of our constituents access that, more parking fees than anything else that we're doing. Would that be
Yeah,
accurate?
days.
As far as revenues
Days.
coming in, yes, correct,
Days, yeah.
at this point.
Yeah.
And then hoping that will change when we start to open campgrounds and have more resources available for people to reserve and do that. But correct, we're not changing any parking fees, the cost of parking fees.
Okay, thank you.
Welcome.
Good morning, Commissioner.
Good morning.
Do you have any questions?
No, just, I guess a statement about how parking fees are important for us managing parking, especially in North Fork.
Right. The new system is very helpful, Kevin. Good job on that. Last year was our first year where we actually had electronic fee parking stations. And I remember, Sergeant, who now you've done ride-alongs with him up in the canyon, Ferrin, I remember him tracking down people that were breaking into our cash boxes all the time. So we don't have that problem now.
Correct.
And most people do carry credit cards. So that's a good system for us as well.
Yeah, I had very good positive feedback from the Sheriff's Office on compliance as well as we opened up this last year, and people were on board, and it was generally a positive experience.
Great. Thank you. Commissioner Cameron, would you make the motion?
Sure. Madam Chair, I'll move that we that we approve an order to amend the fee schedule for Marion County Parks as referenced in Exhibit A.
I second the motion.
A motion and a second. Is there any further discussion? Hearing none, the motion passes. And now we'll move on to,
vote.
I'm sorry, all those in favor, please say aye.
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 The motion passes. Now we'll move on.
I guess
Thank
you could ask for objections. If none, then we unanimous.
You know, in my mind, you said
No, you
yes.
could do that.
All right, item 7 on the agenda, to approve a deed to convey the North Sandium Park and Campground to Marion County.
Great, thank you. Do I need to introduce myself again?
Yeah,
Kevin Thompson, Public Works Parks Program Supervisor.
nice to see you again.
Wonderful to see you all. Okay, here to discuss the North Sandium Park acquisition. North Sandium Park is located along Highway 22 between Lyons and Mill City. For the purpose of this conversation, there are multiple parcels that are outlined here on this map in red when we're talking about the North Sandium Park in general. We're talking about the transfer of these different parcels. The main park where user access is and recreation will happen is in the area that says North Sandium State Recreation Area, but there are a number of other parcels involved with this transfer. The other parcels, for example, out to the far left or the west, are not necessarily accessible. They are kind of, they're inaccessible at this point. There's no roads or anything that's accessing to these properties. They're just kind of wild areas, much like we have in many other places.
There's no maintained trails or access paths.
Correct.
To be clear. You can walk down there if you want to get through the brush.
Some places you may not even be able to because of lack of easements and things like that. But it has the ability in the future, if we decide to expand that, to make them accessible, absolutely. Another notable point is off to the east or the right of the picture there, Santiam Park Road. That is also being transferred over to Parks and being park maintained road to access off Highway 22, which is the way we get to the park. And many of the, all of the folks that live down off that road will access as well. So there's that as well. A little background. So a number of years ago, Oregon State Parks notified Marion County Parks they're in their interest to divest these multiple parcels. And my understanding is that they wanted to reduce the load of resources that they are currently having in this park and other parks to focus on other parks within their system where they are resource poor. I think that was their intent to transfer. So in 2021, both parties entered into a 2-year trial maintenance agreement. This maintenance agreement was, for one, to demonstrate to Oregon State Parks that we had the capabilities and understanding to properly run the park to a level of standard that meets Oregon State Park standards, but also to make sure that we felt comfortable ourselves taking on that maintenance. So it was kind of a little bit of a trial there. In 2023, that trial had ended successfully. We all felt comfortable in moving forward, and currently we have a deed for signing if decided to do so. So the park itself, benefits that this park provides. This park is along North Santiam River, and it provides direct recreational access to the river. There's a natural boat ramp and is in fact one of the key landing locations for folks that are rafting that section of the river. They will generally put in at Pack Saddle Park, which is again one of our parks, and then float down to North Santiam where they'll take out there. There's also significant hiking and walking trails there as well. And significantly, there are 13 working campsites there. And so that's important to us at this point. One, because it expands our campgrounds for resources for visitors, but also within that region of the county, it's the only active campground, open campground, I should say, as a resource for visitors. So I think that's very important there. And as we're talking about revenue enhancement as well, as we're growing our number of campsites that we have, it also helps to support the ongoing mission of the parks program. There's also a great group picnic shelter that can be used for day use or by the campers. And also kind of unique within our park program is that it has drinking water and flush restrooms. Most of our other parks do not have that, so this is kind of a higher level of amenity as well. So bringing in this park to the fold, I think really enhances our portfolio as we look at it from the level of service that we can provide to the residents. And I think it's generally a net benefit for us. So questions or discussion?
I don't have any questions. I feel like this has taken forever, and I'm thrilled that we're here.
I was going to say it a little bit more politely, but
Well, I mean, give me a break.
glad this is here.
Yeah.
Great.
If things would have gone our way, we would have had short-term housing for wildfire victims here, but we couldn't get that done either. Not because of Oregon Parks. They've been a great partner, and their director, Lisa, is really an amazing human. I get that there's, anytime the state wants to do anything with the county, there's some hiccups.
Sure.
Good stuff. Yeah.
All right, I am ready, please.
The only thing I would say is that this next spring, when it gets above freezing, there's some great campsites right on that river. In fact, I think that picture that's up there right now, Kevin, is a picture of pretty close to where one of the campsites is, right?
This is actually Almsville Ponds.
Oh.
But
That's
it looks
a
like
great spot, too.
But you can see
Ponds.
here.
I used to train my dog up at Almsville Ponds.
Oh, okay.
Yeah, did hunt trials up there with her. Okay, there it is. There's the picture of a campground.
Yeah.
Tent sites, right?
Walking tent sites, yes,
Yeah.
at this
Beautiful-
point.
Beautiful spot.
It's a great place to fish,
Yeah,
I hear some.
especially with little kids, because it's like,
really calm.
the water is not overly crazy, and you can access it pretty easily with just a short walk.
And there's a boat,
Take it.
I guess it's not real, it's a
pretty-
boat launch,
yeah,
takeout, whatever.
It's a soft launch is what I call it. 'Cause
Yeah.
It's not like anything you'd see.
Not
in
really
Detroit.
developed, yeah.
Mhm.
Yeah.
Right.
It's mostly for fishing boats that can handle the scraping of the ground.
Right.
Boats, good.
Yeah.
Yeah.
Okay.
Okay, Madam Chair, I move that we approve a deed to convey the North Santiam Park and Campground from Oregon Parks and Recreation Department to Marion County.
I'll second the motion.
We have a motion and a second. Is there any discussion? Hearing none. All those in favor, please say aye.
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 Aye. The motion passes. Thanks, Kevin.
Thank you for your time.
Is this your first time testifying here?
No,
Okay.
it just seemed like it because
No.
I forgot all protocol.
Nope, I just don't, and we see a lot of people, and I was gonna welcome you if that was the case, but regardless, welcome.
Thank you.
Thanks for all you've been doing, Kevin.
Appreciate it. Thank
All right, we're gonna move on to Katrina and Joe. Is he joining you? To consider approval of the contract for services with Village Reach.
Good morning, Commissioners. My name's Joe James, Strategic Planning Coordinator for Health and Human Services.
I'm Katrina Griffith, the Deputy Director for Marion County Health and Human Services, and I'll turn it back over to Joe to walk us through the contract.
Great.
So again, I'm here today to request that you consider approval of contracting with Village Reach to support Health and Human Services in our strategic planning process. Strategic planning allows for the alignment of goals and outcomes for our Marion County community and stakeholders through planful identification of our mission, values, and vision, as well as goal setting so that Health and Human Services can provide a high level of quality programs. Strategic planning allows us to support our employees and communities through collaboration, setting priorities, and allocating resources. So we ask that you consider approval of the contract for services with Village Reach in the amount of $175,000 to facilitate the development and alignment of services for Marion County Health and Human Services, MCHHS, strategic plan for providing services and supports to the community through December 31st, 2026.
Do you need to add, Katrina?
Yeah, I'll just add that this will be a 5-year strategic plan, so, and in alignment with our Board of Commissioners and your goals for the Health Department, we'll be able to set some goals for us to work towards over the next 5 years. And we're really excited to get going on this plan, and it offers a really clear roadmap for our leaders and our staff to understand excuse me, what the vision is and where we're headed. So yeah, we're just really excited and looking forward to getting going with this work and working with our community partners and board in this process.
Thank you. What's the work period of this contract? Like, when are they going to come on? When are they going to be done?
We are hoping that they start in February, and I believe it's through March of 2026.
So you think it'll take a full year to do this work?
So, yes.
Okay.
And that allows us time as a health department to process through the information itself and to be mindful and align with our community health assessment and improvement plan priorities. So it's not that it couldn't be done in a more condensed period of time. I think this 1 year period, I was pretty specific that I wanted it to be close to a year rather than 6 months, because I think the pace at which Health and Human Services is going, we need some of that time to do some internal work.
Okay. Any questions?
No, I know you're excited about this. I know you've been working on it, so
All right.
All right.
probably glad it's finally here as well.
Okay, Madam Chair, I'll move that we approve a contract for services with Village Reach in the amount of $175,000 to facilitate the development and alignment of services for Marion County Health and Human Services. Strategic plan for providing services and supports to the community through December 31st, 2026.
The second motion.
A motion and a second. Is there any further discussion? Hearing none. All those in favor, please say aye.
Aye.
All right, the motion passes. Thank you both so
Thank you.
much.
Thank you.
Thank you. See you, Joe.
All right, Debbie's going to come forward and we're going to talk about a contract for services with Sandia Memorial Hospital. Hi.
Good morning. I'm Debbie Wells, Division Director of our Behavioral Health Crisis Services. I am here to request authorization for contract HE 6320-24 between Marion County Health and Human Services Crisis Center and Sandia Memorial Hospital. This partnership aims to provide mental health crisis services to patients at the hospital during the overnight hours. Contract would be effective upon all required signatures and approvals with a term ending December 31st, 2027, with an option to extend through December 31st, 2029. Total maximum compensation under the contract will not exceed $120,000, which includes all allowable expenses. This agreement strengthens our commitment to providing timely and professional mental health support to the community. Approval of this contract will ensure that the patients in crisis, bless you, at Sandia Memorial Hospital receive the care that they need during critical hours.
do you want to talk about this work a little bit? And would you bring the microphone just a little closer, just
certainly.
in case the TV's straining to hear you?
Sure.
Just tell us a little about what this looks like for the community.
Well, this looks like the staff. So Santiam Memorial Hospital, they have their own behavioral health care team. So they do this work during the day. If somebody comes in need, they will do their own assessments and provide services as necessary. The overnight hours, it sounds like their behavioral health care team is not there. So in the instance that somebody would come into their hospital needing a mental health assessment, they would contact our crisis center. Our staff would respond to their hospital and provide those services in their facility.
Commissioner?
No, we talked about this earlier. I don't have any questions.
Great. Commissioner Dameron?
Good, thanks.
Okay.
Okay, Madam Chair, I move that we approve the incoming funds contract for services with Santiam Memorial Hospital, amount of $120,000 for Marion County Health and Human Services Psychiatric Crisis Center to provide crisis services for hospital patient screenings through December 31st, 2027.
Please second the motion.
I'll second the motion.
Great,
I will.
thank you.
Yeah, thank you.
Absolutely. Under discussion, I actually have a question. So, how do I frame the question? I'll ask you later. I need to kind of put my thoughts together. I don't want it to make, I know that we're doing a lot of work out there, and I know we're doing a lot of work in the community to support folks with behavioral health needs. It just, this, I think during the conversation that we had during management update, we got into the weeds some on what the burden of our system looks like versus Salem Health System and the responsibility of the state. I also know that there was a House bill passed in 2023 that ultimately prevents hospitals from creating a long-term payback for the services they provide if an individual doesn't have insurance or and at some point there's going to be a gap between insurance and costs, and the hospitals are having to write that off. Santiam Hospital has been in conversation with the commission about the challenges they're facing with costs. I guess I'll just ask the question. So when you go out there in the evening, no matter what, we're providing the services to whoever's in need. But what happens in the event that they're not Medicaid eligible? Are we navigating them to get onto the Oregon Health Plan, like right then? What I'm worried about is this House bill causing a huge gap in resources for systems of care, including the county, and how we're going to be communicating that to OHA and the legislature at some point around the increase in costs because of this bill. I mean, basically what it's done is it's created a gap that nobody's paying for. There's no state and federal reimbursement. It's just kind of relieving the patient of cost responsibility, which I understand. Cost shouldn't be a burden to care. But when we're taking this on for the hospital, then it becomes kind of our responsibility, or is it still the responsibility of the hospital?
The hospital would be primary, but we do have the ability to facilitate helping people get connected to services, including Oregon Health Plan.
What if they're not eligible?
Then we would try to find alternatives to care for them. I mean, there are
But does
some
it become,
limitations,
does
certainly.
it remain the responsibility of the hospital, or then does the burden shift to us because you're providing the care at the end of the day for behavioral health?
No, it would maintain with the hospital because they are still a patient of the hospital. We're basically a contractor coming in and providing a service. They remain with the hospital.
Okay, so no matter what, the $120,000 is covering what you're going to be doing.
Yes, that covers our expenses for the assessments.
Okay, thank you.
You're welcome.
Is there any further discussion?
No.
All right.
Call for the vote.
I am going to call for the vote. Thank you for the direction. Hearing none, all those in favor, please say aye.
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 Aye, the motion passes. Thanks, Debbie.
Thank you.
All right, Christina Birchie.
Yeah, the whole department here today.
Well, lots of leadership for the department. Happy to see you all.
Yeah.
Good, excuse me, good morning, Commissioners.
I'm sharing the same frog. Sorry, you don't
Yes,
have water
that's
down there.
I thought about bringing my water bottle in, but neglected to do so. So, good morning, Christina Birchie. I'm the Program Manager for the Housing Services, and today I am asking for approval for the Memorandum of Understanding with Pacific Source Community Solutions in the amount of $135,200 for the Supporting Health for All through Reinvestment Initiative to support our program, creating equal opportunities for individuals and families that don't meet criteria under our HRSN services or our rental assistance services. So specifically individuals with intellectual or developmental disabilities or substance use disorders who are experiencing homelessness and need barrier removal, tenant education to obtain housing. So what this program will do, will connect individuals with our tenant education classes, and if they complete those classes, they have access to up to $1,600 in barrier removal funds that will connect them to housing, and it also connects them to our housing navigation services. Also within this grant, we can provide transportation resources, either a bicycle or bus pass for up to 6 months, sorry. And then also we will be able to provide background checks for individuals. This kind of speeds up the process of being able to house someone because we'll know what the barriers are up front and we can create that portfolio before that we even go to apply for housing for them. So not only are we providing educated tenants to the community, but we are working to kind of tackle that homeless population, and it will serve up to approximately 60 individuals through the barrier removal, and then up to 160 for the background check within a 2-year period of time.
When you say it serves 60 individuals, that's for them going through the
classes, the tenant education classes. So currently, Pacific Source gave us the flexibility to either choose ready to rent or rent well. We're going to be able to train 2 new people to be able to provide these classes. And the reason why we wanted to open it up to rent well, because that allows landlords to access up to $5,000 for any damages that may have been caused if that person is housed with a rent well certificate.
Okay. Commissioners, do you have any questions or comments?
It's good work.
Yeah, well, we know there's a pretty significant need in the community around obviously the homeless problem, but also making sure we can create long-term stabilization for those individuals. And I had a conversation recently with some of our housing providers that they're struggling with permanency for this particular population because of their lack of skill on how to actually live in a household, in an apartment, if you will, and also how to navigate the system like the lease and the utilities and whatever may come with it. So the rental assistance, tenant assistance is going to help them navigate all of that, have the clear understanding if they sign a lease versus month-to-month, stuff like that.
Correct. We can actually provide housing navigation for up to 18 months.
That's great.
We can bill HRSN services once they're housed.
Okay.
And then even before they're housed, we can bill what's called outreach and engagement. That kind of helps with that process. And even if they need more than 18 months, we're able to actually apply and extend it. So I think that our goal really is long-term success and making sure that anybody that we house has the skills necessary to maintain it long-term.
That's great. Thank you for going after this.
Absolutely.
Yeah.
I'm excited we got it.
There's no other questions,
All
Commissioner
right.
Cameron?
Madam Chair, I'll move we approve incoming funds memorandum of understanding with Pacific Source Community Solutions in the amount of $135,200 for the supporting health for all through Reinvest Share initiatives, creating equal housing opportunities program for individuals and families that do not fit within eligibility requirements of existing housing initiatives through December 31st, 2026.
I second the motion.
A motion and a second. Is there any further discussion? Hearing none. All those in favor, please say aye.
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 Aye. The motion passes. Thank you. All right, we will now recess as the Board of Commissioners and convene as a contract review board. And Jennifer and Toby may come forward, and we're going to talk about a Marion County Public Contracting rules. My glasses keep falling off because my granddaughter got a hold of them. Can't see anything, and
Good
Hi,
morning,
Toby.
Commissioners. For the record, Toby Giddings, Contracts and Procurement Manager with Finance.
Good morning, Commissioners. Jennifer Chen, Program Manager of Adult Behavioral Health Services, Health and Human Services.
All right.
So this morning, we find ourselves with a contract that has expired, been reinstated, and expired a second time. And Health Department has a need to reinstate it a second time, which requires us to come to the board and request an exemption to that rule.
This contract would allow us, the extension would allow us to continue to provide the home-based habilitation services while we put out an RFP to find a replacement for services. The 1959 home-based habilitation services are a Medicaid benefit for individuals diagnosed with serious and persistent mental illnesses, and it provides behavioral rehabilitation, psychosocial rehabilitation for individuals who qualify for our choice model services. So these services go into people's homes and adult foster homes to provide training for things like medical support, medication, skills training, health and wellness activities, community access and integration, budgeting, and interpersonal and adaptive skills.
Okay.
All right, I think we heard about this.
Yeah.
Right? Need to do it.
All right. So do you want me to close the contract review board or to accept the contract in this? Sorry.
We're not actually amending the contract in this action. We're just seeking approval to reinstate it a second time. The dollar threshold is low enough that it doesn't have to come to the board to do the actual amendment.
Yeah. Let me make the motion.
Yeah.
I'll make the motion. Madam Chair, I will make a motion that we approve an order granting an exemption from Marion County Public Contracting Rules to reinstate an expired contract with Pelton Project, Inc. to provide home and community-based services, 1915 services for qualified Medicaid recipients as referenced in Exhibit A.
I second the motion.
A motion and a second. Is there any further discussion? All those in favor, please say aye.
Aye.
Aye, the motion passes.
There we go.
All right, thank you.
Thank you.
I'm going to adjourn the contract review board and reconvene the Board of Commissioners. And we are done with our items of the agenda. Is there anything additional for the record that you want to share? Are you good? All right, meeting adjourned.